Infectious disease expert Dr. Zain Chagla joins us now to discuss the latest updates on the pandemic and vaccinations. Good morning to you.
Good morning, Annette.
Let's start off with boosters. Lots of controversy around that.
Yeah.
Lots of wealthier nations now thinking about third shots to hold us over into the winter time, and it comes at a time when so many poorer nations don't even have vaccines for their healthcare workers.
Yeah, I mean, so we are getting 6-month data from Pfizer and Moderna suggesting, there is a little bit of a drop in efficacy over time. They're not perfect vaccines, and likely they will require a boost at some point in time. There are some very small individual groups that may get a little bit more benefit out of that third shot. So people with organ transplants, people with particular cancers, where their immune system isn't primed to make a great response.
But the head of the WHO is saying hold off on the booster shots, right, for a wider population.
Yeah, exactly right. Exactly. And, the justification here is simple. There are low-income countries that have received enough vaccinations to get 1% of their population vaccinated, whereas high-income countries are at 50% or higher. And so, their ask is simple. Listen, wait for another couple of months. Wait till we can get 10% of those countries' populations vaccinated, and then we can start talking about boosters so that the supply can really flow to the right place.
And a lot of the calls for the boosters come from the different variants that are out there, Delta especially. But Delta has really receded very quickly in two regions of the world, in the UK and in India.
Yeah, and in the UK, it is very interesting. The Euro Cup may have actually played quite a big role in the surge of Delta cases. As we're starting to learn, it's coming down. But the other part in the UK is when they do blood donor studies between natural immunity and vaccine-derived immunity, 95% of the population has antibodies to COVID-19. So that may be why we're seeing things come down. And again, in India, we don't know the extent, but it was a catastrophic wave. There were public health restrictions, behavioral changes, and again, a good amount of natural immunity derived. I think it's one country worrying, as again, we may see an uprise as more people together, and again, things start going back to normal.
So it looks as though the Delta spikes very easily or very quickly and then recedes very quickly as well. But I mean, who knows what the next variant could do, right?
Absolutely. I mean, I think the bottom line is in countries that are vaccinated, this variant seems to find its way into populations that are unvaccinated, cause a large rise, and largely leaves vaccinated populations alone. It really is a liability of how much of that population is unvaccinated, which is where the World Health Organization is so concerned about these countries that have less than 1% of the population vaccinated.
Right. Because we have areas, Niagara Health, for example, this week just announced that their last COVID patient was released from hospital. Now, that's not to say they may get another one. That's great news. But we have to consider how very fortunate we are.
Yeah, absolutely. The public health measures we put in place over the last couple of months are paying dividends, and they're still paying dividends now, right? When community transmission is low, it protects everyone. It doesn't say that we're not going to see a rise. And again, that focused protection on everyone starts breaking down, and the vaccine-based protection really is what's left. So, it's still very important, even if the numbers are getting better, they will eventually get worse. And again, it's those unvaccinated people that continue to be represented in healthcare. We all have a due diligence to make sure that those people have access to vaccines and counseling to get them.
What do you, as an infectious disease doctor, see as the biggest threat this week?
Yeah, I mean, I think, particularly in places where vaccines have not been taken up highly, and I think as well, we are starting to see a little bit of tribalism in the sense that, people are us versus them, and, vaccinated versus unvaccinated. And realistically, it's not as simple as that. There's a lot of nuance and a lot of behavior and a lot of acceptance and a lot of, counseling and normalization. So, I think those are two things, one from the global standpoint, but one from the local standpoint. We still have to engage with people. We still have to treat people as human beings and, not necessarily antagonize them because they choose not to get vaccinated.
Okay. Well, thanks for the update. Always great to talk to you. We've learned so much over this pandemic from our weekly sessions. So Dr. Zain Chagla, infectious disease expert, thanks again.
All the best.
Okay, you too.